honored today to continue the healing ministry begun by a courageous few Sisters of Mercy who established Mercy Hospital in Muskegon 113 years ago.
We are standing on the shoulders of many, many people. Well, I think of these beginnings as Mercy being a pebble dropped into Lake Michigan. And you know what happens when you put a stone in water? Consecutive circles. First a small one, and another one, and another. And here we are today.
Early on, Charles Hackley called for the community's help to support the new hospital. As I look around, I am assured that the spirit of Charles Hackley is alive and well. The theme for our philanthropy effort for the new medical center is Imagine, Build, Transform. And we have many opportunities for our community to show its support.
The design of this new facility has taken us way beyond traditional bricks and mortar. We quickly realized that it was as much about redesigning the processes of care focused on the patient experience as it is about designing a building. Every aspect was viewed through the patient's lens. This meant that the time needed for the planning and design work would be extensive. It also meant that we had to empower those who were closest to our patients to make decisions on how the new building should be designed.
They never wavered from their goals and to create a patient-centered design. I was struck with the thought that everyone there was working to make things better for me, for the patient today, and for the patient tomorrow, ultimately to improve all of our lives.
We do like new shiny things with bells and whistles, just like anyone else does. But what doctors care about most is their patients. And what this is going to do for the patients in our community is going to be monumental. By bringing all of the medical services together under a single roof, it will dramatically increase the speed at which patients can access those services when they're needed, both for our inpatient and outpatient communities.
You know, most facilities are built around the convenience of those who provide the care, and we wanted this to be centered around the people receiving the care. My only regret is that I turned things over to Greg a little bit too soon, because I've always wanted to ride in a dump truck.
I wonder if Mr. Hackley would ever imagine that 114 years later, we'd still be guided and talking about his vision.
This will be our hospital. It's designed by our community and created for us, for all of us. I hope you would join me and the entire board in supporting this project that will be known by our children and grandchildren for years to come.
Throughout every step, we tried to keep the patient at the center of our thoughts, and we had, in the design process, we engaged patients to give us their perspective on how this was going to impact them going forward.
This will be a patient-centered medical facility, and it will be tremendous for all of us. And so I'm grateful to Mercy Health for including patients like me, hearing my voice, and making sure for the future of medicine in Muskegon and in West Michigan, our future is bright.